to chat with you about a very exciting topic today. As you guys know, Little Steps Lives we go live every week. This week we're doing it a little bit differently. We are going live on Thursday. Normally it is Monday, but we're going to try that out and see what you guys think. So Thursday, here we go. Today's topic is one dedicated to moms, really. We love making moms happy, and obviously pregnant mothers and moms post-baby, they require a lot of special needs. So we wanted to dedicate something for you to talk about the issues pre and postnatal all around your body and physiotherapy. So want to do a quick intro, but then we'll get into a little bit more about Abby. And a bit of disclosure, Abby has been my physiotherapist for years, pre-baby, post-baby. So I had to bring her in to chat about the ways that she's helped me, but also the way she's helped hundreds of moms out there. And she's got lots of cool tips around what you need to know. Obviously the myths around pre and postnatal physiotherapy, and just ways to protect your body, because I think there's a lot of stuff that is not talked about, and also a lot of unknowns, and it's good to know that it's a lot more common than we think, and there are ways to get around it and to heal. So without further ado, I'm going to put in a few reminders for our readers. The first one is, remember to push the follow button on our Facebook channel. That will give you the notifications every time we have an upcoming live session. We do go live every week, but sometimes the times do change depending on the expert that we bring in. So make sure you click the follow button, and you will get those reminders automatically sent to your phone. The other things to note is to make sure you comment and share. This week we have something to encourage you a little bit more. We do have 3 sessions that Abby has very generously donated from PhysioMotion to give you insight into physio with a session with Abby or one of your staff members over at PhysioMotion. So in order to get those, we have 3 to give away. Just comment, share, and we'll be selecting 3 after the chat. The last thing is to remind you is to invite your friends. If you do have friends that are pregnant or just recently had a baby that you think this chat about physio, pre and post physio would benefit from, just click that little button that says invite your friends. It's super easy, and I'm sure they'll appreciate it as well. All right, so let's get started. So here we are. We've got Abby from PhysioMotion here in Hong Kong. Abby is a British-trained physiotherapist and acupuncturist who has worked with hundreds of moms for pregnancy, postnatal, and beyond. So welcome.
Thank you.
So tell us, Abby, you've got to tell us a little bit more about yourself. We need to get to know you a little bit more.
Okay. Thank you for inviting me here today. It's great to reach out to a much bigger group of women, because we love to help women and moms. And so I'm a UK trained physio. I started my career there, but I've actually been in Hong Kong for 20 years now.
Woo.
Long time.
Yes.
Yeah. So
still loving it?
Yeah, absolutely. Yeah, it's great. So I'm a partner at PhysioMotion. And we specialize a lot in like prenatal and postnatal care, but my specific specialities are women's health, men's health, lumbopelvic pain, acupuncture, and postpartum care. So yeah.
Good. So you have to tell us first, because I think a lot of people get confused. What exactly is physiotherapy?
Right. So physiotherapy is a healthcare profession that uses various evidence-based techniques. So a lot of manual therapy, like correcting joints, and but also like giving out exercises, education, like how to like sleep properly or sit properly at your computer desk. And also advice. So we assess, diagnose, treat, and prevent a wide range of healthcare conditions and movement disorders to improve their quality of life.
Excellent. Yes. And so just tell us, what is the proper way to sit? Am I sitting correctly right now? I'm crossing my legs.
So am I, but you should be sitting right into the back of the chair.
Right into the back?
Yep, you should have some support in the middle of your back. And if
So these chairs are technically not ideal for...
Not too bad,
Okay.
but like probably not the best for a computer.
Yeah.
But then, you should be looking directly in front of you if you're typing,
Yeah.
elbows by the side. You shouldn't be doing that,
Yes.
rotating.
Yes.
Yeah.
Yeah, no, it's good to know these little tips, because
Yeah.
a lot of times you go into an office, you don't realize that you've been typing like this all day.
Yeah,
And
exactly. And then you're getting neck pain and back pain, and so,
all sorts of pains.
Yes.
So I want to dive right into the prenatal side of things.
Sure. Mhm.
It's obviously, I think when I started with physio, I didn't know I needed physio.
Right.
And then it was my second baby that I was like, actually, I've seen the benefits of physio.
Right.
And so I actually went in on the prenatal side in prep, and it helped significantly with
Yeah.
labor and just overall just kind of prepping your body for a quicker recovery.
Absolutely.
But maybe if we
Yeah.
could just talk about your basic physiotherapy tips for that you would give a mother that is pregnant, or a mom to be.
Yeah, I think, just stay active and exercise well. It doesn't have to be crazy exercise, just moderate exercise is great. So, 30 to 60 minutes, 3 to 4 times a week
Is that something that if you're already doing that level of exercise, keep with it, or is it you should be doing?
Well, look, I mean, everyone's different. I
Yeah.
think, but some exercises
You should be doing something.
Yeah,
Yes.
but doesn't have to be hardcore. It could be just like walking.
Yes.
Pilates is great.
Yeah.
Pilates is the best. Yoga, hiking. These are great options. So just stay active. I mean, obviously, as the baby gets bigger, you've got to modify to your normal levels of fitness,
Right.
and and be careful. Yeah.
Pelvic floor muscle training. This is always a big one. Now, I do remember getting this a bit when I was doing prenatal yoga classes. They try to get you to go into that a bit, but I
Right.
think a lot of people don't. They get a little bit skittish about what it is. So maybe if you could explain what that is, and obviously how that affects labor and future recovery as well.
Yes, so basically, like, everyone, I think, should be doing their pelvic floor exercises, or Kegels, as some
Yes,
people know.
Kegels, yes.
So
Pre, post, continuing on.
always,
Yes.
yeah, it's always good.
Yeah.
But and especially when you're pregnant, because obviously the transversus, which is the tummy muscle that surrounds your pelvis, that's going to be stretched, right? So even more important, they should be strengthening from the pelvic floor.
Right.
Right, because the baby's sitting on that, and so they should be doing it regularly. And we always say, do it, incorporate it during your day.
Yeah.
Right, so that like every time you're in the lift,
Yes.
every time you're on the escalator, every time you
I
look
think
at
you
the
told
phone.
me when you see a red taxi.
Yeah,
Or when you see
exactly.
see the
Color
color.
red. Yeah.
Just something that reminds you to just,
Absolutely.
okay, let's do this.
Yeah, so then you're regularly doing it. That's
Right.
much better than like, okay, I'm going to sit here and do 100.
Yes,
Right, because
yes.
it gets tired, and so that's really important. There's also there's 2 different types. There's like the fast twitching. There's the slow twitching. So you've got to address both. And then there's having a strong core really helps you to have a pain-free and problem-free pregnancy.
Right.
Because then your pelvis is well supported, and you're not going to get all the aches and pains, or less likely to. And actually 50% of women don't do their exercises properly.
Yes.
Like just with a verbal command, people say, "Oh, do your Kegels," but
Yes.
actually, they're not doing it properly. Some of them are bearing down.
Yes.
So
Yes.
pushing
Yes.
down, which
That's
is worse.
Yeah.
Right.
But
So-
you really, it's very hard to know if you're. Do you have any tips around trying to figure out if you? I mean, I know PhysioMotion has the ultrasound, which is
Yeah,
like,
yeah.
oh my gosh, I'm totally doing this wrong.
Yeah.
But are there some ways to make
Look,
sure you're doing it right?
Well, look, I mean, you shouldn't do it all the time, but if you occasionally just do it once or twice, like when you're peeing, you
Yeah.
should be able to stop mid-flow.
Okay.
Right. Don't do it every time. 'Cause,
Right.
There's a slight increased risk in infection and stuff, but very, very occasionally, just to test it, you should be
Okay.
able to stop mid-flow.
Okay.
And if you can't,
And that is the right muscle. Yeah.
yes, then
Yeah.
you're definitely doing it right.
Okay.
But
Okay.
you know what? If you're not sure, just come in and see a women's health physio.
Yeah.
We can actually do an internal check, which is the most accurate way to
Right,
check.
right.
And then we can tell you what cues are better for you.
Right.
Everyone's different. Some people like stop yourself from peeing.
Right.
Some people like lifting a tampon, or some people
Right.
like think about stopping yourself from passing wind. It's all these different
Right,
cues,
right,
and
right.
everyone will. Some people like the zipping up. Some
Yes.
people, everyone's different.
Needs something that just connects. I think
Yes.
that's the thing.
Definitely.
And do you find that a lot of do you have a lot of first time moms coming in, or is it more of second time? I mean, do you see any trends that?
We see a
on
mixture,
the pregnancy side?
mixture. I would say we tend to see, there'll be more problems with a second-time mom. Like with multiple pregnancies, it's obviously you run into more problems, but not necessarily. Right. I mean, some people have, quite a worse first pregnancy, and the second one's a dream. So it really just depends.
Yeah. And then the Pilates side of things. Do you typically recommend paralleling?
Absolutely.
Okay.
Yeah, because that is the best way to strengthen your core. And it's safe. It's gentle. And because of the growing baby, that there's a lot of pressure on your pelvis. And your postures will be very different, because of that, because of the shift in center of gravity, and so Pilates will really help to stabilize your pelvis.
Okay, let's get some hearts for those that are already in Pilates.
Yeah.
And how about for those that are going to Pilates? Yeah. So I want to know about the common complaints that you see from pregnant women. When they come into the office, what are the common ones?
I'd say the most common is probably lumbar-pelvic pain.
Okay.
So that
is, you're going to have to clarify. Lumbar.
Right. Okay. Lumbar-pelvic. Yeah. So basically, it's anywhere with low back pain. It could be the pelvis.
Yes.
And it can be presented as different things. So some people will say, "Oh, I've got low back pain."
Right.
Some people will say, "Oh, I've got sacroiliac joint pain."
Okay.
Some people will say, "Oh, I've got hip pain."
Okay.
Or just.
But it's usually in this
around,
region.
Or symphysis pubis pain. That's very common.
Okay.
In the pubis.
Okay.
Or even pain down the leg.
Yes.
Right.
Yeah.
So that's I'd say the most common complaint. And all our physios at PhysioMotion are very highly trained to treat this, because that's one of our specialty areas. Okay. So, and it's very different to, treating it like a normal back pain. It's the pelvis. You have to, gently align it using muscle energy techniques. And then they're like, oh my god, that makes such a big difference. Because like they're in, some of them can't walk. Yeah. Some of them come in a wheelchair.
Well, sometimes I do think that's quite common, like especially if you're a busy working mom.
Yeah.
Or you've got little ones running around. You almost wait sometimes till it's so painful to seek help, and obviously that it takes longer. I'm sure the recovery process and whatnot. So if you do feel those, it's easier to just knock it out and earlier. Yeah. What would be a typical session when you come in with that type of complaint?
Yep. So we normally, assess the pelvis, but we look at the whole body, because some of the problems could be caused like from the ribs even. Because your ribs expand because of the growing baby. It could be your neck, like your posture, because like they're forced to sleep on their side. Yes. And they're normally back sleepers. Yes. And then they're just sleeping on a pillow and they're really squishing their neck. Yeah. And so we look at the whole body. Right. We scan the whole body, and but normally because of the growing weight on the pelvis, it's normally the pelvis if it's a pregnant woman. Right. And so we typically once we've established which side is the positive side, because one side can affect the other. Just because the pain's on the right, for example, doesn't necessarily mean it's the right side. Right. It could be coming from the left side. Right. So then we release all the tight muscles. We gently correct it, and then we teach patients the core exercises to make sure to keep it there. Yes. Right, and advise on postures and how to sit, how to sleep properly. That's very important. Yes. Because how
do you sleep properly?
It depends. If you're pregnant, obviously you'll be told
have to do it on the
you
side,
have to sleep on the side. You have to make sure you have at least one or two pillows, or even a towel underneath. So you want to maintain the 90 degrees on your neck. Okay, all right. Yeah, and then on your side, then you have a pillow in between your knees. Right. Right. And sometimes if the mattress is too hard, and they're lying predominantly on one side, you might need a mattress topper or something. Okay. Yeah. Okay. Good. Yeah. Good tips. So but on your back, one pillow is fine. But obviously, as your pregnancy progresses, you can't lie on like that so much.
Yeah. I'm a stomach sleeper, and so I've always been challenged with the side sleeping. But I know it's definitely better. Yeah. Excellent. Are there any other things before we move into the postnatal side that you want to mention on the prenatal side?
absolutely. So things like neck pain,
Okay.
upper back pain, rib pain, like I said, because of the the poor postures normally, and the ribs expanding because of the accommodating the grown baby.
Right.
Physio can really help with that as well. Just telling you how you should be sitting, sleeping, even sitting on the sofa at home.
Yes, yeah. Well, everything's changed, right? You're just allowed
you've
to...
got this big weight,
Okay, so we have some questions coming in. Okay, let me see if I can understand that properly. Okay, so this one is postnatal, right?
Okay. Yep.
How do you say that?
Diastasis recti.
Yep. Mm-hmm. Which is a very common thing that people are talking about. So we'll cover that one when we get into the postnatal.
Mm-hmm.
Mother's thumb
and low back pain. Right. Yeah, that's another common problem.
Okay.
So sometimes it's called Derkel veins.
Okay.
It's just a condition they call it. It's normally the thumb tendons.
Oh, really? So it's actually pain in this area?
In this area.
Okay.
Some people just have wrist pains. Some people get like weakness in their hand.
I've never heard of that. That's so interesting.
It's very, very common.
Huh.
So basically, if they're feeding, like they're kind of like angling.
So this would be a postnatal pain as well. Okay.
Yeah. Okay. So whilst we're here, we'll talk about it.
Yeah.
So they, it's about advising how to hold the baby properly using a feeding cushion if necessary.
Okay.
We might issue a splint to help so they're not stressing all the time.
It gives them a support during. Okay.
It could be their neck position when they're sleeping. So we give them advice about that.
Okay.
And sometimes if there's a lot of swelling, we have a lymphatic specialist physio in our clinic
that actually does is it massage oriented?
Yeah, it's very gentle though.
Okay.
So but just to move the lymph because it's all like clogged up.
Okay.
Yeah. So a lot of people get that antenatally.
And so that's when you're feeding.
Yeah.
Okay.
Some people get it even before the baby comes.
Right.
But like after feeding as well, so it can come anytime. It's very common.
Did not know that. That came from Agnes, right? Is that?
Right.
Thank you, Agnes, for asking that question.
Yes.
I'm learning something new here. So the other question I think was it a prenatal? The lower back pain?
Lower back pain.
That's
the lumbar.
Like that's for everybody.
So that's the pelvis.
Probably the most common complaint, I would imagine.
I would say that's a malaligned pelvis.
Yep.
So from the relaxin as well.
Yes.
That's released after the first trimester, and with the weight of the baby as it grows. So I would assume her pelvis is a bit malaligned. Okay. And which is why she's getting the low back pain.
Excellent.
Yeah. Oh. But totally treatable.
Totally treatable. I mean, that's you've helped me on that. And it is interesting because I do remember when the relaxin does settle in, it goes away. Yes. You become less flexible, and all of a sudden you start getting some pains that maybe you didn't have before as well. So you're like, where did that come from? It's because the relaxin has changed. Your body's changed. Yes. So so we're going to move into the postnatal side of things, which there'll be a lot of questions. But before we move into that, I just want to have a quick reminder and also a check-in if there are some more questions from our pregnant moms out there about physio, questions that you have about any pains that you have surrounding prenatal, and then we're going to move into postnatal. Quick reminder as well, we are giving away 3 sessions, thank you Abby, and Physio Motion, for you to go in and see Abby and to understand about what you can do to improve your whatever the issues that you might have, or even to prep you for recovery or labor, whatever that may be. So we're giving 3, just comment, share. We'll be picking those 3 individuals at the end of the session. So any other questions about prenatal?
Actually, there's things like morning sickness.
Morning sickness is another one.
Or a breech baby. We can do acupuncture to help.
Oh, really?
That.
You are. Yeah, that's right.
So that's another thing that we can help with a lot of antenatal moms. And even like I've had some women, quite a lot of women coming in because they have problem conceiving. Acupuncture helps really helps with that.
Well.
It's like a holistic treatment where they they kind of, it's almost like strengthening your body to hold the baby.
Did not know that as well. So very interesting. Okay. All right, let's move into postnatal.
Okay.
Myths and questions.
Right.
So I guess the first question would be is when do you typically see people coming in, they've had their baby, they come in to see you. When is that timeline?
Right, so normally I would say generally 6 weeks.
Okay.
But I mean, they can come in any time.
They can, yes. But that's more of a typical timeline.
Because, it's a bit crazy at the beginning.
Yes.
It's like...
You don't notice.
And also, like, that's normally when they've had their 6-week checkup with their obstetrician.
Yep.
And then they'll say, okay, you're okay to exercise. So I always say, look, you should always come in for a postnatal physio checkup.
Right.
So what typically we check the lumbo-pelvic position.
Okay.
So make sure that that's all good before you start exercising. But also we check the pelvic floor.
Okay.
I mean, I'm the pelvic floor specialist, and I like to do it internally because it's a lot more accurate.
Right.
But if some women are not comfortable with that, we can view it on real-time ultrasound also. And
I do remember that. Yeah.
Yeah.
It's quite enlightening.
Well, it's great because then you can see it and you're like, oh wow, you know.
Yeah.
But especially if you're having like more incontinence issues, then for sure we should do internally because it's a lot more accurate. Like you check the different layers of muscles, and so it's all good, right?
But it is quite common, so don't get scared.
Very common. It's totally fine, and but of course you have to be comfortable with it as well. And we don't push at all. And if you're not comfortable, it's fine.
Right.
Yeah. So we also check the rectus diastasis, which is the abdominal separation.
Yes. This was, I remember, very. I didn't know that this happened after.
Right.
So maybe if you could explain what that is.
So this is the six-pack muscle.
Right. Which we all have.
And everyone, like during the 3rd trimester, as the baby gets bigger, it will split.
Okay.
Everyone will split.
It's always gonna. It has
to because the baby is growing so much. So it's not something bad.
Right.
But we do want to maximize the recovery of it after. Right. So after giving birth, like really, you should really be doing your core exercises to kind of like.
But when you say core, I think there's definitely an illusion of, okay, I got to get on these.
And
that's the big no-no, right?
Yes.
So that's I think a lot of people don't know about.
Yes.
Yeah.
So a lot of moms.
The crunches.
That's really, you shouldn't be doing that, because that will make the rectus diastasis worse.
Right. Which is that bread box that kind of pops out.
Yes.
That's a warning, right?
Yeah, it's literally, there's different grades, but like there's a hole in your tummy essentially, and then you're doing that, you're making that hole bigger.
Okay.
Right. So you shouldn't be doing stomach crunches or sit-ups until your rectus diastasis has resolved.
Okay.
Yeah. So we check that.
Right.
We also check, your core and global muscle strength, which is really important. So it's really, I think every woman after giving birth, it's a huge impact on your body, and people just don't really talk about these things,
right?
And
I do remember when you did the checkup, you measured it, right, by like thumbs
with fingers.
Yeah,
finger weights.
And I remember you just don't realize it because you look at your body and you say, everything looks like it's still there.
Yeah.
But then you check the amount of thumbs that are separating these two muscles, and you need to know that that's your goal is to bring them back together.
Absolutely.
And that's it's a bit of a shocker, but it's so important because I think later down the line, right, you can have a lot of problems if you don't get on it early.
Well, it's part of your core, and it'll give you predisposure to back pain. It can even make your pelvic floor or prolapses worse, which we'll talk about later.
Yes.
As well. Yes.
Yes. So we did talk about abdominal separation. Mm-hmm. So are there any other things that we want to talk about around that, or should we move on to additional?
We covered everything. A lot of people will ask me like how soon will the core get back into shape?
Okay, that's a good question. Yeah.
But you know what? It's very individual.
Right.
It really depends on so many factors, like your fitness level beforehand. What age you are, what type of delivery you had, how many pregnancies you've had. But I say give it at least 6 months, 6 months to a year.
To feel like it's
okay. To really get your core back. People are like impatient and they want to get back, and but your body's been through a huge thing.
And there's a complete disconnect, right?
Yeah.
Like I do remember being like, I can't even feel my core. I don't even know where it is.
Yeah.
So it's just also kind of getting that connection.
And the first few months is crazy with the baby anyway, right? And like you're not even thinking about yourself.
Right.
Yeah. So give it time. Don't rush. And you've got to gently get back into your exercise, not just go in there. Like you've got to make sure everything's in line.
So be easy on yourself, ladies.
Definitely.
I think that there is a lot of stress. There's a lot of push, especially with the Instagram and all these different feeds out there of what people are supposed to look like after having a baby, and yeah, you need to be easy on yourself.
I think so, definitely.
Are there any other additional issues that you see women face post baby?
Yes.
Okay.
Lots.
Okay, so let's talk about those.
Like the pelvic floor.
Yeah.
Okay, so I'd say the most common problem that women face after giving birth is stress incontinence.
Okay.
And no one talks about it.
Which is
the involuntary leaking of urine. It could be from
it doesn't sound glamorous,
no,
but it's
not
very
glamorous.
common.
Very common.
Yes.
Like it's not normal, but
Yeah.
it's common. Right?
Yeah.
So it could be from a drop to a complete bladder emptying. I mean, it's quite
So what would you say would be a warning sign that is not normal, or that you need to go see somebody?
Yeah, well, look, a lot of women will say, oh, the first couple of weeks was really bad.
Okay.
And I'm like, okay, but, and then if it resolves after, a few weeks, then fine. But really at the 6-week mark, if you're still leaking, even if it's a drop, it's not normal.
Yeah.
You should get checked.
And that's leaking just in a normal situation, or is that
normally,
on a trampoline?
That's quite hardcore. But there's two different types of incontinence. Right. There's like stress incontinence or urge incontinence.
Okay.
Right. You can have a combination of the two. Okay. I'd say stress is definitely more common.
Okay.
So that's things like when you're stressing your pelvic floor, like coughing, sneezing, jumping.
Yep.
A lot of mums are horrified because they're like, oh my God, I emptied my bladder. I went to rise, I jumped with my kids, and I completely leaked, right? And they're like, oh my God, my bladder was empty and I still leaked, right? And I'm like, yeah, it happens. But it's okay, we can fix it.
Yes.
Right. And and running, when they start exercising, running, jumping, these are the common stresses of the pelvic floor. Okay. And
the other one, you said stress?
So urge incontinence, that's more when you like, okay, I've got to go now.
Okay.
And if I don't find a toilet, they're going to leak.
Gotcha. Okay. So both of those are common, but it is something that you can
totally treat and get better. That's right. Good. You shouldn't be living with that at all. Okay. Right. Okay. Because if you leave it, it just doesn't get better. Right. Right. And then you can't go to the trampoline parks. No. Ever. You can't play with your kids. And see, most of the women I see are obviously postpartum. Right. But I then see a next wave of women. So if they've left these problems, during menopause, menopause, what happens is your estrogen drops, which is the hormone that keeps all your tissues nice and plump. Right. And but then everything's exacerbated. So then they come in and they're like, oh my God, I'm walking and I'm leaking. Yeah. Right. So, and then they come to me. Right. And I'm like, why didn't you come to me 25 years ago, when you had your kids, and be like, oh, I didn't think anything could be done, and I thought it was normal, but it's not normal. Not normal. Not normal. Yeah. Okay. So there's, get on it. There's also, you can get fecal incontinence too, which is even less glamorous. Oh dear. Yes. But again, that can be totally fixed. Okay. Yeah. Okay. So don't just settle with these problems. It's totally treatable. Okay. You just need to get help. Yeah. So we covered that. What are some of the other ones that we have not covered? Okay, prolapses. Okay. Very, very That's a big common word. What is a prolapse? Prolapse, which sounds quite scary. It's again very common. So I'd say 50% of women who have had children have prolapses. So it's very common, but it's not normal. Right. So look, some people don't even know they have them. So they're asymptomatic. But a lot of typical symptoms, women will say to me, oh, I feel this heaviness or pain in my perineum area. Right. Or they'll say, oh, I feel like something's falling out. Right. Like a tampon or something. So there's also things like, or they could have pain with intercourse. Oh, okay. Right, which is, again, not normal. Yeah. But, or they have this feeling that they don't void fully. Okay. So it's basically a bulge from, it's a falling in of either an organ in your pelvis that shouldn't be in your vaginal passage. So it could be from the bladder, it could be the uterus, it could be the cervix, or it could be the rectum.
Okay, I think I like the word prolapse better.
But, again,
right.
totally treatable.
Yes.
So, if you have these symptoms, then it's probably from a prolapse.
Right, okay, okay.
Yeah.
So that sounds more urgent. I mean, do you find that people come in a bit more?
Yes, because that's quite distressing, because then they're kind of like, oh my God, like I'm feeling this pain, or I don't, or I see this thing there,
right.
It's not normal.
Yeah.
And, so it's fine. We're talking about everything here.
Yeah,
right?
I know. True. So another one, I know we haven't dived too much into like postpartum pains after like having sex, because I know that's another one that's quite
absolutely
common.
Yeah.
So maybe we could touch on that a little bit.
So normally after birth, like honestly, having sex is probably the last thing you want to do. You're exhausted,
right?
And but normally after 6 weeks, the obstetrician will give you the go ahead to say, okay, you're good to have sex. And it's painful,
right?
Like so if it is painful, not always, but if it is painful, normally it could be a hormonal thing, because you're a lot drier,
right?
Because of the hormones, so you will need to use lubrication.
Okay.
I always give advice about that, but more so actually a lot of tearing and or from episiotomies.
Right,
so a lot of tight bands and scar tissue. Okay. Which, as women's health physio, will actually go in and release.
Okay.
Yeah.
Okay.
And that will really help as well.
Got it.
Yeah.
Okay.
So it shouldn't be painful.
That's the main message. Is that it shouldn't be.
painful.
And if it is, you need to get that checked out.
Yeah.
Got
Absolutely.
it. Okay, excellent. Well, Abby, thank you so much for sharing all this information with us. And we barely scratched the surface. I know there's a lot of things that we can go on and in more detail, right? So, but it is very personal, and it is something that I think this has been a good chat about just some of the basic things that I think a lot of women just don't they put off, or they think is okay, and they'll get over it eventually. And I think you gave some great advice in terms of this is what you need to go to get checked out. This isn't normal. No. So if you are feeling this way, that there is a way that can treat you and get you back to where you need to be. So thank you for all of these things. So just a couple of things before we dive into some questions. In terms of reminders, we've got the PhysioMotions website will be on our description, or is it in the comments? It'll be in the comments. There you can actually go and click the link and then go to the Contact Us page, where you can get, you send out brochures, right?
Yes, so to all our postpartum moms, we actually have some really informative leaflets. Okay. Yeah, it's about breastfeeding, it's about posture, your core. So kind
of a one-on-one on everything that you do after having a baby.
Absolutely. Okay. Yeah. So, you're more than welcome to just kind of contact us on our website, and we're happy to give us your address. We can mail it out. Excellent. It's all good advice, and how you should be carrying your baby or sitting, and it's all good. Great. And this video obviously will continue on, so do feel free to continue commenting. We'll check in with Abby to see if we can make sure we get those questions, all of them answered. And of course, we do have the 3 sessions that we are giving away. Thank you again for that with PhysioMotion. So just a couple of summary questions before we dive into some of your extra questions that we didn't get covered. What do you find the most rewarding part of this job? I really love the fact that I really enjoy making people kind of make a difference to their quality of life, and helping them. Right. Yeah, I'm a real people's person. I chat a lot, as you know. She's a lot of fun. And and I find it very satisfying that you're really making a difference to their quality of life. You're changing some of the most important things in their life, and they tell me such intimate things, and so there's a real trust there. Right. And I also feel very blessed that I actually love what I do. Right. And it's a really fun job. Like you never have 2 days the same. It's very
Right.
variable.
Right.
Like, you know, people come in with so many different problems. It's
Right.
not just pelvic floor, you know, it could be neck pain or a back
Right.
pain or ankle sprain or, you know. So it's very variable, you
Right.
know, and, you know, in Hong Kong it's great. You meet so many different people from different cultures and
Right.
backgrounds. And
Right.
I really enjoy that part of my
Yeah,
job.
it keeps always changing, right?
Absolutely. Yeah.
Excellent. Now, have we forgotten anything that we need to make sure and cover before we open it up to some questions?
I think one thing I should also talk about is breastfeeding pain.
Yes, yeah, we haven't even touched on that.
Yeah, no one talks about that either.
Yeah.
And so that's really, you know, 33% of women have this, you
Okay.
know, and especially in the first few weeks when the feeding patterns are being established. And physios can help with this. I don't think most people know.
When you say breastfeeding pains,
Pains,
what would
yeah,
be,
yeah, yeah.
like just...
So, you know, engorgement,
Okay.
mastitis,
Okay.
blockages.
Yep.
Yeah. And
I didn't know that physio
Yes,
could help with that,
yes,
so that's
yes,
good.
yeah.
Okay.
So, and we work differently to like lactation
Right.
consultants and midwives. Physio treatment involves like lymphatic drainage treatment.
Okay.
We do taping to
Okay.
help the lymphatic drainage, and we also do a high dosage of ultrasound,
Okay.
which is a lot less painful
Okay.
than really, you know, doing that deep
Right.
massage to do that unblocking.
Okay.
And
Okay.
that really helps a lot with breastfeeding problems as
good
well.
good to know. Now you also
Yeah.
work with little ones too, right?
Yeah,
So
that's right,
what
yeah.
kind of things do you work with
you know,
the little babies?
with babies, we have physios, you know, like if they have like croup by necks or something,
Okay.
yeah, or you know, any like feet. Probably we have a pediatrist
Okay.
in our clinic for
Oh,
like
okay.
feet and yeah.
Okay. Ah,
So,
interesting.
yeah. They're just little human beings, really.
I know.
Yeah.
So cute.
Yeah.
So thank you so much again. I want to open it up to our readers to ask us any of your questions that you have for Abby today. So do we have any questions, Karina?
So we have a comment from Kitty. She said she's experiencing neck, shoulder, and lower back pain from feeding and carrying her 7-week-old to many
Right.
flights.
Yes, I mean it's probably her sleeping posture. Sorry, her feeding posture.
Okay.
So again, she should really be sitting right into the back of the chair.
Okay.
Okay, having some support in the middle of her back.
Like a little pillow or something?
No, just like if it's an upright chair, better than a
Okay,
sofa.
okay, oh,
you know,
yeah.
so something upright, and you know, have the baby supported on pillows. Like
Okay.
get a feeding pillow. Even.
Right.
Yeah, and then so that then you're just supporting the baby's head and you know bottom. And bring the baby, you know, to your boob rather than boob to,
Yeah,
you know,
where
because
you're
then you're
hunching
kind of
over,
doing that.
yes,
Yeah.
yeah.
And you know, a lot of women obviously they're looking down. It's a beautiful moment. You're,
Yes,
you know,
yeah,
watching
yeah.
your baby feed. So actually, don't just look down. Really make sure that you're looking up. You know, like take rests and look up occasionally, and if you have to look down, you know, you can kind of do like a retraction and nod, which is not so, you know, attractive, but
Right.
it's much more ergonomically better, so that she's like nodding rather than doing that.
Got it. Yeah. No, I can definitely
Yeah.
see. Hope that was helpful.
Yeah, and probably her low back pain, I'd say she's probably got some lumbar-pelvic issues again with
Right.
her pelvis alignment. So
I think another thing that I remember is I would carry the baby on one side a lot.
yes,
And so you end up popping your hip up,
Yep.
And it's comfortable because they're heavy.
Yes.
And so you end up using your
Yeah.
stronger side,
Yes.
and then you're just
And you're
completely.
upslipped, and then you get upslipped.
Yeah,
So
yeah.
so try and carry on both sides,
Right.
and yeah.
Just be mindful of that. I remember
Yeah.
that being a good
Yeah.
tip as well.
variation is key.
Yeah.
Mhm.
Yeah. Keep
Yeah.
changing it. Don't always do what's comfortable.
No,
Most of the
exactly.
time, but not always.
Well, you're multitasking. You're trying
That's
to
right, I know,
have
it's hard-
baby
it's hard
and
to
do different
remember,
things,
yeah.
Yeah. So yeah.
Oh.
And let the dads carry. You know,
That's
if
right.
you can. If they're around, let them carry.
And you do have physio for dads too, so if they carry too much, they can also get physio. Do we have any other questions?
Earlier we had a question from Sophie.
Sophie? Okay.
Sophie, for this.
Ah, yes.
Oh, the diastasis.
Sophie,
Yeah.
yes.
So so that we kind of talked about it.
Right.
So that's the abdominal split, the
Right.
rectus diastasis. If she's worried, she should come in and get it checked out. If she thinks she's got an excessive.
And what if you leave it too long?
Then it just doesn't get better.
And then, because I know a lot of people have talked about the surgeries, which is also when when would you recommend even looking at that as an option?
That's your last option.
So that's the last resort.
Yeah,
okay.
That's the last resort. I mean, we can really help. Like even aligning the ribs really help with the
Okay.
exercises because that's where the nerves kind of go in. Your pelvis position is so important. You know, you've got to do your Pilates and engage your core, right? And you know, most women do really well.
Right.
Yeah,
right.
and you know, like one finger width is acceptable. Like
okay, that's
considered as normal.
So
right?
one finger is
one
kind
finger
of
width at the umbilicus.
Okay.
At the belly button.
At the belly button.
And half above and below is considered okay.
Okay. Okay.
But more than that, you probably need to.
And you said it should get there after how many?
You know, like most of the healing actually will be in the first 6 to 8 weeks.
Okay.
So it's really important to engage. So as soon as the baby is out, you should be doing your core exercise, your pelvic floor,
right.
Engage your core. That's totally fine to do.
Got it.
Straight away.
Got it.
Yeah.
Okay.
Mm-hmm.
Good tip. Any other tips? All right. No more questions. All right. Well, thank you so much for joining us on Little Steps Live today. Huge thank you to you sharing all your tips on pre and postnatal physiotherapy. For those that are watching it after this goes live, please feel free to continue commenting, sharing it with people that you think that would benefit from this chat. We will have Abby available as well to answer those questions. And of course, ask and comment, and we do have 3 sessions to give away as well. So we'll be announcing those as well in the comments, so we'll be in touch there. Thank you. We want to keep you in the know and on the go with Little Steps. Tune in next week. We do go live every week. So tune in next week. We'll be live on Monday. Green is the new black with the big Conscious Festival that's coming to Hong Kong, out of Singapore, coming to Hong Kong for the first time. So very excited about that. That's Monday at 2:30. So thank you.